with us right now, Shane Foss. Shane, you are the founder and CEO of Hooray Health, found on the web at hoorayhealthcare.com. Shane, thanks so much for joining us.
Oh, thanks for having me, Josh. Really looking forward to the talk.
I imagine most people smile when they say the name of your company.
I love it, right? Hooray Health, healthcare worth cheering for.
And it seems like, it's a subject that I think if you ask the average person, what do you think of the state of healthcare today? I don't think you can get a whole lot of people that are going to get excited as they start talking about that subject, but you do.
Yeah, well, what I love about it is, because of our name, I can instantly take out any animosity. I'm like, look, do I look like the bad guy naming my company Hooray Health?
Yeah.
So no, I'm the good guy.
Yeah, good. All right. So now that we have a good guy in the healthcare industry with us, give us an overview of what Hooray Health does.
Sure. So we're a company dedicated to providing affordable insurance solutions for the full-time hourly, part-time hourly population that can't afford major medical. Real simple. Yeah. Our goal is to give them a great user experience and give them affordable access to healthcare. Look, if you can afford major medical, we want you in major medical. We do not compete against major medical. We compete against not having insurance. Right. And so our number one goal is to make sure that if your kid is sick, take them to the urgent care, talk to a telemedicine doctor, take them into the doctor. You're not going to have to worry about the crazy bills. Health insurance has gotten so strange over the last, 15 years, really. You look at the deductibles and, they're at $5,000. Well, oh, hey, you have a $25 copay, but then you got to pay the balance on that back end that you're legally liable for, and you have no idea what it's going to cost, right? So that's why I started Hooray. We created a national network of retail clinics and urgent cares. So CVS is one of our large partners, Walmart. We have 14 of the top 20 urgent care brands in the United States contracted with us. And what's nice about it is you walk in, it's a $25 copay. There's no balance bill, period. I had one of the big health companies plans. I had a $6,000 deductible, and I went into an urgent care and I walked out of there with an $800 balance bill. Yeah. And when I called them, I said, how are you in network? And I get an $800 balance bill. Well, we got carve outs, we got, and so I just kind of eliminated that. And because the average person just doesn't, they don't think about that stuff.
Man, I got to tell you that as a business owner, I have had, I almost got to get emotional here, right? Because I've had just terrible health insurance for so many years of our married life. When I left corporate America, became self-employed, and there's just nothing good. And
it's just too expensive.
Oh, and I think of all of the times that, man, I'm getting so emotional because this is, I know that there are other people that are like me, right? And, when, maybe you're looking at a treatment option for one of your family members, and you're going to get hosed on that. So you say, sorry, we're just gonna have to walk that one off, or, this would be an extra, test that maybe we should do, but look, I'm going to have to pay, $700 for that because I haven't reached my copay yet. And man, it sucks. It really sucks. Yeah. And so how, again, help me understand how Hooray Healthcare works compared to, is it traditional insurance? Is this more of a health share plan? Help me understand this.
Absolutely. So we are a fully insured product, but what we are is we're what you call a fixed indemnity, and then we have what's called an accident medical expense policy. So, right. And we, on the back end, we kind of make it look like one policy. And the reason we do that is because when you look at the CDC data, the average American will see a doctor 1.9 times a year, right? If you're under the age of 45, if you're 45 to 65, it's 3 times a year. Of those visits, 11 to 14%, depending on your age, is going to be an accident-related injury. And those accident related injuries can get expensive. And so what we did was we said, okay, we're not major medical. We don't cover the big surgeries. We don't cover cancer. We don't cover any of that stuff. We just, our plans start at, $65. Okay. So we're very affordable to get the basic care in. And what we did was we looked at all of the most common uses, and we said, all right, how do we take care of them? So we're what you call first dollar coverage. So I have a copay in our provider network, but we are a fixed indemnity that pays a full amount on the back end. We have an accident policy. So great example, I had 11 stitches in my hand this about a year ago, and I went into the ER, and they accept my insurance card. They send the bill to the TPA, which is a third party administrator, which adjudicates claims. And we don't have a deductible on our $5,000 accident policy. So they paid 100% of the bill. And on my EOB, which is an explanation of benefits you get, it says it's paid 100%. And the provider's happy, you're not out of pocket. And so we're really you can kind of look at us as a minor medical plan, right? We're not going to cover, the pregnancies, we're not going to cover the major surgeries, but, when you look at the statistical data, until you're, up in your mid 60s, that's when stuff really starts happening, and you'll be on Medicare. But again, our goal is really covering people that don't have the ability to have major medical, right? That's our primary focus, is taking care of those people. One of the most, probably the story that hit my heart the most was it was about 2 years ago. A mom had taken her daughter into an emergency room for something that had happened. She had fallen off a bed or something, and she had a $1,800 bill that she couldn't pay. And so they were already sending her collections, and now her daughter takes her Dramamine. And so she calls Poison Control, and Poison Control says, take her to the emergency room right now. She needs to get, her stomach pump. So instead she looks online, what do I do? So she goes over and buys the Epicac at CVS. Goes and gives her daughter. Her daughter's thrown up in the emergency room parking lot, and she sat out there and watched her daughter to make sure that she was going to be okay before she took her into the emergency room. Why? Because of an $1,800 balance bill that she's now going to collections for. And so we just want to we want to eliminate that stuff. We just look, there's enough issues going on right now with with inflation and everything else going on, where your dollar doesn't go very far, but you shouldn't have to risk your child's life, right? From a health issue. So.
Yeah. I remember, my son was in wrestling practice, and he got dehydrated, I guess, kind of passed out. And so the coach had called me, and I, kind of drove there as quickly as possible. And, and again, this is before, thankfully, we finally, qualified for some decent coverage and stuff. Thanks to a really good accountant who helped us manage our tax strategies, that we were able to kind of fit, the appropriate levels to finally get some good coverage. But this is before that. And then I also finally qualified for VA healthcare coverage. So that's my own, just in case anyone's like really worried about me, I want you to know, we had some good solutions, but Shane, you and I absolutely would have been talking for sure. Had I learned about you a few years ago. But I remember, going to, rush to go see my son. I show up, ambulance is there, and I'm like, oh crap, and I go in there. He's doing all right. He's lethargic and stuff. I see two EMTs, and obviously I'm concerned that's my first concern. So I'm concerned for my son's well-being. My second concern's right up there. It's like, holy crap, these guys, I know if they engage, bam, that's going to be a big bill. And so thankfully, he was doing all right enough that we were like, okay, let's, just give him the electrolytes and liquid and rest and stuff. He was all right. But man, just how crummy is that? That I need to.
Horrible.
Yeah, it's just and I felt so bad as a dad, but that's, again, at the time, that's what we had healthcare wise. So now, so does Hooray Health, did I understand this right? So it supplements like a very high deductible plan? Is that what I don't know. Okay.
No,
Sorry. Explain this to me.
No,
Explain
no.
like I'm five one more time. Make
No,
sure I
that's
get
okay.
this.
So you really, so in a major medical plan, you have theoretically you have unlimited coverage above once you have all of your out-of-pocket maximum.
Yes, right.
We do not do that. So in other words, we're what's called first dollar coverage. So
Okay.
that means we pay $1. You go see a doctor, we're paying for that, or we're paying for that bill. With major medical, what would happen is you pay your $25 copay, and then they're gonna send you the balance of your bill because you hadn't met your deductible, right? But we don't cover all the catastrophic stuff. We just cover the basic hospital visits. We'll do minor surgery, some stuff like that, some little hospitalization. But again, we're covering the basic needs, right? What you need, getting your annual wellness visit, talking to a teledoc, going to see a physician, in an urgent care. If you break your arm, you break your leg, something like that, we take care of that. Those are the coverages that we take care of.
Yeah. And so what happens then if you do have something that's catastrophic, heaven forbid?
Well, you do what you'd do if you didn't have insurance, which is you'd go to a county hospital, that a teaching hospital, and you'd have to work out something there.
Okay.
Yeah, 100%.
Yeah. Yeah. Okay, good. All right. So good. I mean, that's bad. But good at that. I get it. That's what I was saying. Good too. Okay. So talk about how you work with employers, because I have to tell you that that's also a sore spot, right? In that I've lost employees because I don't offer, I really can't afford to offer a healthcare program.
Right.
And so I've had a couple of good employees who are like, sorry, I got to take a job that has maternity. I'm like, wow, that stinks. I can't really do that.
Yeah. Well, honestly, I'll tell you what we do. Look, we're a small business as well. We've got 20 plus employees, and we use a medical cost share for our catastrophic. And then for our basic care, we use Hooray Health. Everybody's got Hooray Health, and it works great, and it's very affordable. I mean, look, Hooray Health basic plan is $75, anywhere from $65 to $75, depending on the plan you go with. For an employee only, an employee family is $200. So then you get a medical cost share that you can go above and beyond that. And the medical cost share has been around for 25 years now. I mean, personally, I think it's great. And the reason I think it's great is we use Sedera. They're a partner of ours. Look, I'm a smart guy. I am not spending $36,000 a year for health coverage for my family with a $6,000 deductible. Does not make financial sense whatsoever.
Right.
I'll spend 10 grand, but I'm not spending 36,000. Right. And so,
that's a big ticket item for the average family. If we're talking 10,000, over 12. I mean, that's what's, I got to do the math now. It's 10,000, even the divided by 12. That's still $833 a month. I mean, that's a big ticket item for the average family.
Yeah. Well, so here I spend $8,160 a year for my family. Yeah. That's what we spend. So less than 10 grand.
Yeah.
And, the reality is you see more and more of these plans coming out where they've got 10, 12, $14,000 deductibles. Yeah. And, the reality is most people don't even have $400 in their bank account. I think the majority of Americans don't even have $400, So again, there's a lot of things that could happen in the healthcare system. Unfortunately, the American Hospital Association, which is a good part of the issue, is, they're one of the largest, funders in Congress, right, with the lobbyist groups. And, it's just not going to change. I mean, 70% of them are nonprofit, but they're making huge profits.
Right.
And, you know, it's just, it's one of those things that's going to literally take a catastrophic, you know, event to where things finally, you know, people want to change. And so until then, there's going to be innovative companies like us that get out and they're trying to address basic issues. And, you know, and what's great for us is our customer experience is wonderful. We get great feedback from the employees that are on our plan. Employers like you that can't afford a major medical can come in and pay $100 a month, and then, you know, the employee pays 50 and they get a pretty decent plan and some coverage. You know, and if they're going to go on maternity, there's other alternatives where they can, you know, where you can go with a medical cost share or something. And I think there's alternatives out there. There's enough alternatives out there. And Sedera is a non-religious plan, so you don't have to worry about. You know, that
we were on a healthcare plan. Yes, we were on a healthcare plan, and they were very, you know, very religious. So you had to.
Yeah, Sedera is a non.
You had to make some pledges.
Yes, that is that. I remember that.
Yeah. So Shane Foss, again, your website, Hooray Healthcare.com. So much more that we could talk about on this subject, you know, barely just scratching the surface about, you know, the conversation around healthcare. And, you know, again, my consumer advocates really kind of come out in this conversation, my other company, Saving Angel. So listen, thank you so much for helping to solve solve problems out there and being part of the innovation that I think honestly it's private sector that I think is going to, I think we're going to continue to see a lot of great ideas and a lot of growth in private sector and saying we have problems here. I have ideas on how we could fix this. And that's really what we need. So, thank you again, Shane, for your work with HoorayHealthcare.com. And so, again, you can go to HoorayHealthcare.com. I see there's a big yellow button right there. It explores our benefit plans. You can kind of get started. Looks like I see some explainer videos as well that might do a better job than I can explain, but you've done fantastic. Shane, thank you so much for joining us.
Thanks, Josh. Really appreciate it. Keep doing what you're doing. We need more of you.